everybody. So one of the things that I treat a lot in my office is hip pain. Everybody has their own definition of what their hip is, and this always makes me laugh. Some people think their hip is the front of their leg hip area. Some people actually call their hip the actual quote unquote hip joint. Some people say their hip pain is in the back. Regardless, we treat it all if we can. And we try to get the hips and the pelvis as balanced as we possibly can to avoid and alleviate hip pain. Well, one of the ways that we can determine what's going on with the spine and the hip is x-ray. So we take x-rays, digital state-of-the-art x-rays right in our office. And so one of the things that I was recently surprised about, a patient came in to me complaining of hip pain, and she claimed it was all in this, she just said generalized hip area. So when we look at what a normal x-ray looks like, front to back, or actually we're looking at this particular x-ray from the back. This is the pelvis, this is the tailbone, and the whole lower back spine. It should line up in a nice straight line, and the hips or the pelvis should be even or level. Well, this is what I was unpleasantly surprised to see when I x-rayed my patient. So not only is her pelvis completely unlevel, but she has a degenerative scoliosis, or a little curvature in the spine, that is compressing all the nerves in this area, which happen to be the ones that go into the hips and all the way down into the legs. So the point and the moral of the story is we never know what's going on unless we take an x-ray. So this is a much more degenerative lumbar situation, but her symptoms and the nerve pain is actually in her hips. She's doing really well under care. She's starting to get relief. Even with this arthritic degenerative situation, we can help a lot of people who have hip pain. So come in. We'll never know unless we take some pictures and find out what's actually going on with your pelvis and your hips, so that we can see what's going on, so we know how to treat, put a treatment plan together, and get you out of pain in the shortest amount of time possible. Okay, thanks so much. We'll see you soon.